Every day in the United States, approximately 130 people die from an opioid overdose. Opioid-related fatalities are now the #1 cause of accidental death and the death of young people in America. Someone dies every 5 to 6 hours from an opioid overdose in Tennessee. There is something readily available to help, and anyone can learn how to respond. The same way people can learn how to do CPR to help someone breathe, or use an AED defibrillator to restart somebody's heart. Naloxone is easy to obtain, simple to administer, has no side effects, and can be used to save a life by reversing the effects of an opioid overdose. In Tennessee, state law allows anyone who has received basic instruction to administer naloxone in good faith to a person who may be experiencing an opioid overdose. Who should have access to naloxone? Well, the answer is everyone, especially if you or someone close to you are prescribed opioids, which could be intentionally or accidentally misused, or if you or someone you know suffers from substance use disorder. How do you get naloxone? Well, in Tennessee, anyone can obtain naloxone directly from a pharmacist without a prescription. A pharmacist will provide basic instruction as well on the administration of naloxone. Most insurance programs cover or offer a copay option for naloxone. Cost range will be between $0 and $150 depending on your insurance. There is no cost with TennCare, and up to 2 doses per person per month are available. You can use your FSA, HSA, or HRA accounts. You can get it from major pharmacies like CVS, Walgreens, and Rite Aid, and some local and community pharmacies. You can also consider pharmacy delivery or by mail if you don't want to go into your pharmacy to get it. Don't let fear or stigma get in the way of saving a life. You will not be flagged by your insurance company if you request naloxone. We understand that substance use disorder is a disease with significant health risks, and any individual should have naloxone available to use as needed. Individuals without insurance or who cannot afford naloxone may qualify to obtain an opioid overdose reversal kit from a regional overdose prevention specialist, or ROPS, in Tennessee, along with training and education at no cost. Resources such as medication-assisted treatment, inpatient and outpatient care, and long-term treatment options may also be available. To find these resources in your community, go to www.tn.gov/behavioral-health/ROPS, or simply go to the tn.gov site and type ROPS in the search bar. These resources are funded through grants provided by the State of Tennessee Department of Mental Health and Substance Abuse Services. With the staggering number of deaths currently associated with opioid overdose, it's more likely now than it ever has been that you will encounter someone having an opioid overdose. Don't let your ideas about addiction prevent you from becoming part of the solution and saving someone's life. Thank you for your time.